All right, guys. Well, a couple more people are joining. We're going to go ahead and get started here in just a minute. We'll say hello to Shannon when she pops on. And then we'll kind of get the ball rolling because I know we have a super fun topic today and I can't wait to dive in, give you guys the floor to kind of discuss. And then I'm sure we have a lot of questions as well, kind of about, you know, all this face mask craze and what's going on. So Shannon, are you able to hear us?
I am. Hi, guys. Hey, ladies.
Hi.
Hey, Shan.
Hi.
Thanks
I'm going to put myself on mute. You're welcome.
Can you see? Oh, you can see us. Yes, and we can see you.
But I'm going to walk and I'll make you sick if I leave the video on. So I'm just going to I'm going to listen, though.
Perfect.
Okay.
All right, everyone. Well, I always like to start off with a cheers. So today's theme, we're kind of going to cheers to adapting to new environments. Obviously, today is 2019 is kind of a whole new environment for all of us. So cheers to adapting to it and embracing it, and hopefully positivity that will come out of it. Cheers, everyone.
Cheers. Thank you.
To that.
Myrita's got a whole bottle there.
Oh, it's just a cider. Don't worry, it's not a whole bottle of wine.
Not a whole can, so you know.
But I'm really excited about today's topic because it involves at least one of my favorite things, which is fashion, and the other new craze, which is face masks. So today's topic is called fashion versus function. And I mean, did you guys ever think that Instagram would be promoting face masks? And not just any face masks, but we have Gucci, we have Fendi, we have face masks going for hundreds and hundreds of dollars. And then just a few weeks ago, we were on such a short supply of face masks in general. You know, with the hospitals are in super short supply, people can't have them for themselves. People are wearing, you know, using bandanas and anything they can get their hands on to try to, you know, protect themselves. And now we have so many of these clothing brand companies coming out, making these products. And we're kind of just like, okay, this is great. And I totally would rather have a bedazzled, amazing, you know, sequin studded face mask than look like a hospital patient or construction worker. But do they really work? And which one should we be purchasing to make sure that we're safe? So I would love to introduce our guest host today. We have Tracey, who is our client and relationship sales manager here at WineSociety, moved from Cincinnati to California, but prior to being with WineSociety, she had 20 years experience in the health industry. She was a dentist and of course was enabled to kind of interact with, you know, health precautions and standards and just best practices. So she's going to share a little bit of her knowledge today, along with, I'd love to introduce also our second guest host, Myrita, who we just recently realized that we know each other from long, long ago. And she is a local healthcare professional here in California with 15 years of experience in community-based public health. She's in maternal and healthcare, food systems, emergency preparedness, health crisis, communications, and a master's in health promotion. And we've heard that you're currently pursuing a doctorate in public health.
We're working on it. The royal we.
Cheers, girl.
One day I'll be Dr. Myrita. It's just a matter of time.
I love it. I love it. Well, without further ado, I will leave it over to you girls to take over the floor. You know, tell us about these face masks, and we'd love to learn a little bit more about it. And then we'll open up the questions kind of towards the end. But during this presentation, everyone just, if you have any other questions or comments, add them into the chat, and I'll be sure to bring those questions up at the end.
Perfect. Thank you, Angela.
Yeah, I'm pretty much, Angela, I was just going to take the lead in introducing Myrita, but she said all the wonderful things about her. You know, I invited Myrita to join just because she has so much knowledge in, you know, the sector. And in my practice as a dental hygienist, I mean, obviously this was part of my uniform every day. It was required to wear every day in between patients, you know, but now the US and all across the world, you know, it's strongly encouraged to wear a mask when you go out in public. And in some areas, like here in LA, it's actually required, or you can get a ticket. So just kind of like
$1,000 ticket in LA.
Yeah.
Wow.
Yeah. So it's actually required. So as Angela had touched the point on, being able to grab, you know, getting these kind of masks, you know, we didn't have access to that. So that's where we're seeing this explosion of ads everywhere. Everyone's making masks, from fashion companies to even in Cincinnati, local nonprofits are taking costumes, you know, Shakespeare Company, from their costumes and putting them into masks. So a lot of people are using it to make great, you know, money for great causes. Some are using it to make profits. But at the end of the day, there's so many different fabrics. There's so many different sizes, so many different colors, you know, the fun, like Angela said, you know, being all cool, sparkly. But, you know, when Myrita and I were talking about this the other day, it's like, you know, does this work, you know, as well as this, you know? So I'm going to let her take the lead with her experience and take the floor here, and then we can answer any questions.
I will.
On that.
So the sun is kind of moving, so I'm going to have to keep moving with it so that I'm like sort of in the sun, but not squinting. So I apologize if I'm a little bit dark as I move around. First of all, thank you for having me. I will preface this conversation in that I'm not a medical doctor, so I'm not a physician. I do have, 15 years of epidemiological experience, and epidemiology is the study of disease. And so, for example, coronavirus is a disease; it's an infectious disease. So I also, have an extraordinary number of colleagues, of family members who are deeply involved in responses to the COVID pandemic. And so my goal here is just to be a resource of information for you. If I don't know the answer to your question, I'll be honest. I won't make anything up. And so you can put anything in the chat with your contact information. And if it's a question that I can't answer, what I can do is go to my colleagues and ask them. So just know that I'm excited to share what I have to offer you, and I have a wealth of additional resources for other questions you may have. So if you want to have, conversations around something other than face masks, we can do it. So I just want to first say, we wear face masks in terms of our COVID-19 pandemic right now is...
I'm well, thanks.
Shannon.
Jen, you want to put yourself back on mute?
Whoopsie, sorry. A friendly neighbor.
Friendly. So for us, masks are about protecting other people. The reason that we wear masks is not necessarily to protect ourselves from virus. And so that's something that I think feels confusing, because when you see someone with a mask, you think, maybe they're trying to, maybe they're immunocompromised, maybe they're trying to not get sick. But in COVID-19, we're wearing masks so that if we, for example, are what's called asymptomatic, which means you don't necessarily have symptoms but have been exposed to coronavirus, or you're what's called in the incubation period, which means you've been exposed to it but you don't have symptoms yet, but potentially are still contagious, that you're not infecting other people. Does that make sense?
Mm-hmm.
Yeah. And so the thing about coronavirus that we have to, really about COVID-19, because, coronavirus is a strain of viruses that we have seen, for many, many, many years. There are flus, common cold, et cetera, that are coronaviruses. So that, for example, is not new. What we're dealing with COVID-19 is a strain of virus that we've actually never seen before. So we don't really know how it operates. We don't really know how it's transmitted. Scientists, epidemiologists, clinicians, infectious disease professionals are working to, kind of gather that information, but we're still really learning as we go. So, for example, we know how a common flu is transmitted. There's a couple of days where you may transmit it to other people without knowing it, but you get pretty sick pretty fast. And then you're kind of laid out, for maybe a week to 10 days. So you're generally not infecting anyone other than who's in your immediate home circle, right? So with coronavirus, there's an extended incubation period and people can be asymptomatic. So there's a lot more of an opportunity to be infected. And so I know this kind of sounds scary, but it's not. There are things we can do to take precautions, like wearing masks, for example. So I just want to stop there. Any questions to begin with about what coronavirus is? How is COVID-19 different? Anything like that?
So why is it, thanks for explaining the difference between COVID and Corona, but why is it called
Yeah.
COVID-19?
It's called COVID-19 because coronavirus that's the COVID portion of it. And it was identified in 2019. Yeah, so so coronavirus is a strain of viruses, again, that we're exposed to, I mean, in all reality on a regular basis, but COVID-19 is actually the sickness that's caused by this particular coronavirus.
Mm-hmm.
So COVID means it's a novel meaning new, novel coronavirus that we haven't seen until 2019.
Okay.
Does that make sense?
Yeah, I'm probably the only one that didn't know that.
No, I didn't realize that COVID-19
No,
is the actual sickness.
I
But
thought
yeah, COVID-19 is the actual, it's also called SARS-CoV-2 because if you guys remember, there was a SARS epidemic. What was it? Probably 15 years ago, 10 or 15 years ago now. SARS is a coronavirus as well. It's just a different one than what causes COVID-19. So it's kind of a mutation of a coronavirus. So SARS it was certainly a pandemic, but it wasn't an international pandemic in the way that we're looking at with COVID-19, if that makes sense.
Okay, I have another question about the masks.
Yep. Oh yeah, we'll definitely get all into the masks, but please ask your question right off the bat. Let's do it.
Didn't about 850 people die during the original SARS epidemic? Wasn't that what it was? About 850?
You know,
it was not that many.
Numbers. Yeah, I don't know the numbers off the top of my head, but the mortality rate was not as, I believe the mortality rate was not as high as it is with COVID for sure.
Yeah, and they stopped it because they took a lot of
numbers. Yeah, so a rate means like the percentage of people that died based on the number of people that were sick. So when you look at a virus, like you can't really look at just straight numbers. Sometimes you have to look at like a mortality rate. Like if 1,000 people got sick and then only 10 died versus if 100 people got sick and only 10 died.
Mm-hmm.
Does that make sense? So mortality rates are different.
Yeah.
And so someone had a question about face masks in particular.
I was gonna say, why don't you jump in and start talking about the face mask because you might answer the question.
Let's do it. So there are so many different kinds of face masks out there. So PPE is personal protective equipment, and so that's a broad term for what protects someone from any type of bacteria, virus, anything transmittable. So that can include a face mask, a face shield, any kind of coveralls, hazmat, just depends on what it is. What we're looking at right now is when you hear about a PPE shortage, we're looking at two different things. We're looking at what's called an N95 mask, which I'm sure everyone has at least maybe heard of, and a surgical mask, which is what Tracey held up in that first. Yeah, exactly. Tracey has her
oh,
so when we're talking about controlling virus transmission, the best thing to do that, fortunately and unfortunately, is an N95 mask. So for example, it would be great if all of us as civilians could have those right now. But because there is a supply chain shortage, we really need to reserve those for our healthcare workers that are in what are called like high exposure places, at hospitals and ICUs. Then we've got surgical masks, same thing. They're a little bit less effective, but still great at preventing virus transmission by, covering nose and mouth with, I think it's polypropylene. I mean, I'm getting into the real science of it, which is kind of unnecessary, but it's polypropylene. And so if we can't get a hold of those, what do the rest of us do? So first thing is that any mask that you have has to completely cover your nose and mouth. So if you think about it this way, air takes the least path of resistance. So if you put a bandana over your nose and mouth and it's open at the bottom, the air is still going to go out and create kind of these respiratory droplet clouds that are potentially infectious for COVID-19. So first things first, when you have your face mask at home, when you make one, when you buy one, it needs to completely cover as appropriately tightly as possible around your nose, down the sides of your face, and then through the bottom of your chin. Does that make sense?
Yes,
Yeah.
thanks.
Yeah.
Yeah.
Yeah. And if you're able, so for example, if, you know, now we can have all of these fashion masks or, you know, homemade masks for people that sew and I don't, you could even ask them to put, for example, like as kids, like we all had pipe cleaners, you know what I mean? Like we played with those little pipe cleaner things, putting something across the top so that you can actually pinch with metal around the nose to make sure that there's no additional air coming out. Does that make sense?
Yeah.
Mm-hmm.
Yeah. And when it comes to the type of fabric that you want to use, all viruses are different, all bacteria are different. They all have different sizes in terms of microns, you know. So when we're talking about different cloths, it's hard for us to determine exactly what types of cloth are best for certain viruses or bacteria without a big scientific study. So what we're looking at right now with COVID-19 is obviously you don't want to use anything with like bigger holes or bigger weaves. So like nothing that's knit. Nothing with yarn, no scarves that are yarn, because think about it. There are like some pretty big holes where respiratory droplets can come through, nothing with mesh. If you're going to use something like a bandana, you want to fold it over as many times as is possible and comfortable so that you have multiple layers of fabric that are preventing virus from coming through. And also something that has recently been coming out again. We're not, you know, as scientists, we don't want to say do this for sure until there's a lot of scientific evidence, but there is thought around using like a nylon stocking or like a pantyhose over the top of and the outside of your cloth, you know, homemade face mask that might be an additional barrier. Does that make sense?
Yeah.
Yeah,
That's interesting.
Yeah. So again, you know, I think what's hard as we talk about, you know, face masks and what's the best, you know, we don't, to be quite honest, outside of N95 masks and surgical masks, we don't exactly know. We know what not to do. We know nothing with big weave. We know nothing with, you know, open areas for breath to escape. Nothing with just one, you know, small layer. But we're, you know, still kind of trying to find the best possible version of what a preventative face mask might look like. So I think it might be helpful to take specific questions.
Sure. Yeah,
Right
we
now.
have a couple in here right now.
Perfect.
Sherry asked, how do they determine, this is regarding the virus, like how do they
Yeah.
determine that it's not SARS or is it new?
So so that's based on testing. So it's a form of, it's called SARS-CoV-2 in another scientific way to describe it. So it's a different type, again, SARS is a coronavirus, so it's a different type of virus. And so what happens when infectious diseases start to pop up and clinicians, doctors, scientists can't identify exactly what it is, they start to do testing to try to figure out, okay, you know, what are the virus molecules here? What are we really looking at? Is this something we've seen before? Data, and then send it out for additional testing and additional kind of like a barometer check from other international organizations. So right now, in terms of testing, you know, everyone's trying to develop different types of tests. And so tests are now coming from everywhere. You know, they're coming from South Korea, some are being generated here in the US, you know, because the importance long-term is the test. And so that we can understand really what how contagious this is and what the health effects are outside of just, you know, a mortality rate, which of course we don't really want to, we hope we don't have to think about a lot.
Thank you, Myrita. All right,
Sure.
guys, we're getting close to time, so I want to make sure we get to some of our other questions as
Yeah,
well.
let's do
I'm going to combine, I think, like 4 or 5 questions.
Yeah.
And these all have to do also with face masks. So
Yep.
you described a little bit of the fabric that's used, and definitely not to use, you know, really, really loose materials and loose woven. There's a question around like, what material is the best? Should we be looking for face masks that have an option for a filter? Is the N95 really the only thing that'll really protect us from anything? As far as I know, for me personally, I read that I might have it backwards, but the virus is like 0.03 microns, and the masks, regular masks only emit like 0.01 or 0.1, something like that. So it can still go through. Can you help us determine like which one should we go for?
Well, the thing about what I do want to say, first of all, one thing is that masks don't replace rigorous hand washing, social distancing, staying at home until, you know, scientists and physicians in your state have created a kind of release of stay-at-home orders. So I think that's one thing that's also really important to say. This is not in place of or isolated from other really important tactics for control of viral transmission. There's not a whole lot, unfortunately, that can protect us from a mask perspective, protect us from getting it from other people. So eyes, nose, mouth are the ways that this virus will get into your body. So that's why everyone's heard, don't touch your face unless you've washed your hands, wear something over your nose and mouth so that you don't touch your face. And so again, face masks are really about us protecting each other so that if we have the virus, that it's, we're not unknowingly transmitting it to others. When it comes to the actual microns of the size of microns mean like the size of a virus and what it can penetrate and what it can't, yes. From a full kind of coverage perspective, yes, an N95 mask is the best. But unfortunately, we do need to reserve those primarily for our healthcare workers. So like, don't go out and buy like a ton of them. If you come across a box of them, maybe save one for yourself and donate the rest to frontline healthcare workers. But when it comes to, you know, the types of materials that you're using at home, I haven't seen any science around filters or not in terms of what we would have access to that might work. But that's something, you know, I think we will get more information on, and I can certainly keep an eye out for and kind of share back with this group if that's at all helpful.
So like no folding up a coffee filter and putting it in place. We don't know if that's really, it could work, but maybe
that's
not.
the thing. It doesn't hurt. Right now there, you know, and this is what's really hard about being a scientist right now and also being a human is I want to tell you like, yes, fold up like 10 coffee filters and put them behind your bandana and that's going to help. But we don't know, and I don't want to provide any additional misinformation because there's tons of it going around right now. You know, I think nothing can hurt. You know, when we're thinking about both, you know, protecting our loved ones and protecting those around us. But, you know, there's still a lot of research to be done in terms of what's called like a viral load, you know, what comes out of your mouth if you happen to have a coronavirus. And how to prevent that from truly spreading. But it doesn't mean you shouldn't, like everyone should leave the house with a face mask. You know, yeah, it's kindness, it's compassion, it's preventative medicine. And, you know, when we think about, you know, first of all, we don't ourselves, none of us want to get sick, but we especially don't want to get others sick. And we don't want our loved ones to be sick. We don't want those that are immunocompromised, those that, you know, that don't have that are in high risk categories that don't have the opportunity to like start at the baseline with their immune system. So that's really the importance of wearing a face mask. And if you want to bedazzle it, there's no problem with that. If you want to buy a beautiful Louis Vuitton one, if you can afford it, there is no problem with that. If you
I was gonna
just
put
make
this
sure it
under
fits all
and
the
then
way
the-
around your mouth.
multiple times, you know, there's it's just right now important to cover your nose and mouth because that's all we know.
Mhm.
Honestly, when it comes right down to it, as public health scientists, what we know is that coronavirus is it sticks in respiratory droplets, and then it can live on surfaces. And so the more that you can prevent anything coming out of your nose and mouth that someone else might accidentally touch and then might wipe their eye, for example, or come home and have picked something up from the grocery and not wash their hands before they handed it to their child. You know, we just want to be really conscious of the preventative measure that this is. And information is still evolving. So what I'm telling you right now will continue to change. So if I've told you, you know, everything that I'm saying to you is all science backed, but you know, there are epidemiologists and physicians and clinicians and other public health professionals like myself that are continuously working on this to make sure that all of this information can get to people so that it's less confusing, because it's really, really confusing right now.
Mhm. I have one more question too, like as far
Yeah.
as like, say you wear a face mask and you go to the store, so obviously you're like exposed.
Mhm.
Like, should we wear kind of one mask and then wear another mask to kind of protect that mask? And then when we
So-
get home, do we leave it out in the sun so that does the sun kill it? And does it, like, how should we protect ourselves once we get home?
Yep.
Or should we get disposable ones or throw them in the wash as soon as we get home?
That's
How
such
can
a
we
great
keep ourselves
question. Yep, that's such a great question. So first of all, there is nothing wrong with wearing, I mean, I'm an environmental girl through and through, but in this time, there is nothing wrong with wearing single-use gloves.
Mhm.
And, you know, when you do your either weekly or whatever it is, run to the grocery, wear gloves, you know, just for that time period. So that then when you take them off and you wash your hands first before you take your face mask off, there's less of a likelihood that you would transmit any type of virus particles onto some part of your face. Does that make sense?
Mhm.
Right.
My suggestion is that, and I'm not a real germaphobe, but this pandemic has asked me to think very scientifically and also very thoughtfully about hygiene processes. And so my thing is, if you're going to the grocery store, or you're going out into, you know, an enclosed space with other people, despite whether or not they're social distancing, I would wash your mask every time after that. If you're going for a walk with your dog, and you know, you're not necessarily coming in contact with other people. I mean, granted, we're wearing masks in Los Angeles. Like if you want to go for a run, you have to wear a mask. But you know, those circumstances are a little bit different. But when you're potentially touching other things that others have touched, or you're in an enclosed space, I would wash your mask every time. And I know it sounds like a lot, but precautionary measures are just real right now.
Better
know,
to be safe than sorry.
Yeah, I
there's a
think
good
Tracey.
balance around it, and it, you know, the routine will come. You know, the routine will come where this doesn't feel as scary, because it feels scary right now. It feels scary for me, and I'm a scientist, and I know, you know, epidemiology, and it feels scary. But I think we'll get a little bit more comfortable with what these precautions mean, how we can easily put them into, well, not easily, but put them into our daily lives with some adjustment, and making sure that, again, we're coupling wearing a face mask with doing, you know, acting responsibly in terms of social distancing, acting responsibly in terms of like really good hand washing, acting responsibly in, not, like when you go to the grocery store, not like going crazy and buying all the crazy things that you think you might need, we just have to be, we have to act with kind of kindness and compassion and respect, and also reality that this is, and this might sound scary to everyone, but this is going to be our reality for 18 months. So we'll be doing intermittent social distancing for 18 months because it will take another year at least for a vaccine to be developed and be ready to be given to everybody kind of en masse. So we just have to get, the quicker we can get into this protective routine, the better, because we wanted, there's going to be another surge around traditional flu season, and we want to not strain the healthcare system any more than we have to. So the more we can integrate this into our daily life and be cute doing it, there's nothing wrong with that.
I just
For
wanted
sure.
to reiterate one thing that Myrita said with the glove situation. And I'm sure most of you don't have disposable gloves just hanging around the house. I've been using my, biking gloves or even winter gloves or just something, because the point of wearing the gloves is also, you're not going to touch your face most likely if you have the gloves. It's more of a kind of a psychology as well too. When you have the mask on, when you have the gloves on, you've touched something in the store and then you're going to touch your face, you're going to look at the gloves, where before it was just such habit that people are touching things or whatever. So you can use any of those type of gloves, and then when you get home, throw all that stuff in the washer, hot water, and that's
Hot
fine
water,
too.
hot dry.
So it's okay
that's great,
if it's not
Tracey.
disposable. Again, the point of kind of the masks and the gloves right now is to keep you from touching your face. So when I go to the grocery, the mask and gloves get put on before I leave the car, touch everything, take one thing off before I touch my thing, put it back on. Then they get off before I go in my car, touching everything. Everything gets washed. Hand sanitizer in the car. As soon as you get home, wash. But a lot with the mask and gloves, again, not touch your face, wash your hands. So it's okay if you use your winter gloves and wear them to the grocery store, that's fine too, and throw them in the washer, but that'll keep you from touching your face.
And me and my husband were having this kind of debate about Lysol, and I went to Lysol's website, and their CEO speaks, and he said, we don't know yet. We don't know if our product works. We can say that if you go to Lysol.com, it's the first thing that comes up. This is new. We can tell you that it does kill things in the past. We're not there yet. Now that was last week. Maybe there's a different video out there, but they said exactly.
I wish I wouldn't have heard that.
Yeah.
No,
I think I'm all clean at home.
No, and a lot of it's psychological too. Continue to clean in the way that makes you feel comfortable. But that is true. And, we also have to think about, the more we use something that kills 99.9% of bacteria and viruses, what's that 0.1% doing and where is it living? So we really can't at this moment get too worked up about that, but it's very true. Angie, we, as scientists, we've never been in a position where we've had to really test some of those claims in real time in a level like this and in an emergency like this.
Yeah, and I thought it was very good and honest. Like he said exactly that.
Yeah.
We know it kills 99% of what we've tested and proven.
Exactly.
This has not been proven.
Right. This is a new thing. That's why it's called a novel coronavirus. It's something that we haven't seen before. And so again, the one thing, it's not as though we don't know anything about SARS-CoV-2 or COVID-19, which is the symptoms and the sickness from this particular coronavirus. We do know some things about it. We know that in some ways it acts like a typical coronavirus, and those are, for example, susceptible to Lysol. So as we continue to learn more, we remain hopeful in that. And until further notice, Angela, keep spraying your house down with Lysol, there's like soapy water, the thing about a virus is it's, so a lipid is a fat, and these viruses are like stuck in a little fat cell. That's kind of how they like infiltrate everything. Soapy water breaks that lipid outer cell so that the virus can't survive anymore. So like there are some things that we do know. Is it still really contagious? Yes, absolutely. But, I don't want to be, I don't want to catastrophize you know, on this call. Like, you know, I'm honest about the information that we have, but also, you know, keep doing what you're doing. That's part of how we navigate this, both logistically and psychologically.
Sonia had an interesting question really quick. Sonia, are you able to unmute really quick and ask your question about the shared spaces?
Yes. I was just wondering, I did ask Trace this prior many times. I have a shared laundry room, and I know my building's huge. I'm pretty sure that somebody in the building may be infected one way or another. Is it safe to use the laundry? Actually, is the clothes inside while it's cleaning? I know outside you have to clean, you know, keep the laundry, you know, buttons clean and whatnot, but as the clothes are washing, is it actually killing anything?
So I know that for those of us that are very laundry loving and very laundry particular, my heart is going to hurt telling you this, because I'm going to tell you to wash everything on hot and dry everything on hot, which of course is like not to be done with some of the lovely things that we all have. But that's really the scenario right now in a shared laundry space is, you know, if someone washes something, for like, again, like we're talking potential scenario, if someone that's exposed has clothes that have coronavirus on it, and you know, it gets put into the wash, it gets washed on cold, conceivably could there be particles in there that then could get onto your clothes? Yes. So my suggestion is wash on hot, dry on high heat. And oh, this is one thing too that I think some of us, I'm a no shoe in the house person, and a lot of people aren't, and there's no judgment around that. But I think it's particularly important in this time to think about like clothing, for example, Sonia, where you've been outside in it, or you've gone to the grocery store in it, or shoes where you've been, you know, kind of walking around in shared spaces. You know, those things should be like when I come home from a grocery store run, I immediately, first of all, I immediately wash my hands. Then I take everything off that I have and I immediately put it into a plastic bag. And I have that laundry that's in a different place than my other laundry, where my inside laundry, where, you know, I go to sit down on my bed, for example. So again, you know, we are understanding how long coronavirus lives on things, but in terms of a shared laundry space, safety first, wash on hot, dry on hot. And for the things that can't handle that, wait to wear them for a little bit so that you can wait to wash them for a little bit.
Agreed.
Does that help, Sonia?
Yeah, it does help. I was just wondering, even if you do it on hot, and if it's still like, is it maybe best not to do laundry or wait it out for a little while? That's what my thoughts were.
So again, we don't know, and I hate, as a scientist, I hate saying that, because it's what I want to give you is a definitive answer, and that's hard for me to say. But I think that you. Oh, sorry, my it's starting to get off and on here because all of my wonderful neighbors are coming out. I would not recommend doing laundry, but I would just, again, wash on hot and dry on hot. And if you feel uncomfortable, don't do it. That's the thing right now is, you know, so much of it in this unknown area, in this gray area, part of it is how do we like protect ourselves psychologically? How do we make sure that like we can kind of manage some of these things? So until we know more, if that's, you know, something that you don't feel comfortable with, don't do it.
Thank you so much.
That makes sense?
Yes, it does.
Yeah.
Thank you, Myrita. All right, guys, I'm going to flip it over to something a little bit fun. Tracy, I think that you shared this with me earlier. I'm going to try to share my screen. I haven't done this before, but let me see if this works. Hold on one second. Okay. So I think the thing that we have coming up for us next, Tracy shared this with me. I about died.
That's hilarious.
I love
You not
it.
only have to look good on the bottom half and get that ready for summer.
I
but,
tell
like,
you,
need
I
to
have
make
seen
sure you're
so many
fashionable.
things on Instagram with my friends that are like amazing sewers, you know, people that have access to vintage fabrics, like they're doing these beautiful, like, you know, mask, like dress, you know, combinations, or like, you know, wear around the house matching your mask kind of situation. So, you know, we definitely have to have, you know, we have to have, I don't want to say fun in this, although we definitely should all have fun. But, you know, we have to keep it, to keep it light, to support one another, to be aware that this is a completely unprecedented time, not only for medicine and for our world, but for us as human beings. We've never experienced anything like this. And the importance of things like this, Angela and Tracey and Angie, you know, being able to come and connect and have conversation and talk through both things that are confusing, and also just have some, you know, FaceTime with people is really a part of how we're all going to get through this. So just thank you for bringing me as a part of this, but also bringing people together. It's really special.
I think, to be fair, we're going to need a shot for Aaron. You know, we're going to need to find him a nice swim trunk and mask, just to be fair. I don't think he's rocking that.
I mean, Aaron, a trikini.
I like it.
I don't know, you know.
Can't forget about the guys.
Well, Tracey and I have a wonderful friend and her family who have like, she doesn't like to slather sunscreen on her kids. So they have like full on like sun shirt, sun pants. So we're just going to have to find sun shirt, sun pants with matching masks or matching hoods for, you know, for those friends. So it's all about, you know, your own style in this. Just don't be afraid, do your thing, you know. And again, Angela, if you would like to share my information with anyone, you have my personal email, but I can also send you my UCLA, my professional email, if that makes people feel.
Thank you. I think that would be fantastic. Yeah. I want to wrap up with two other quick things really quick. Sure. I do want to plug, I'm really big on supporting small businesses. I do have a friend that her parents, I think it was her aunt and uncle, have a shop in Berkeley. They were tailors, and they totally converted their company to making face masks. I'm going to share the screen. Awesome. And basically they're called Masks for You. And this is actually where my question prompted about kind of the additional filler or filter that's inside. So they hand make all these masks. They're super safe. They wear all the protective equipment that's needed.
That's amazing.
Their masks are actually pretty cute, and it looks like they form a little bit around your
They look actually, that's like the, if you're looking for a, so when you see that like rectangular mask that Tracey showed, the surgical mask, you know, we've all seen those. They expand to go over your nose and mouth very much in the way that these are made. So those, you know, Angela, these cloth masks are great because they have that, you know, over the bridge of the nose, under the bottom of the chin, you know, complete protection. That's really, really important.
Perfect. Thank you so much. It's good to hear. And they use the coffee filters.
Hey, you know what? Again, at this point, we don't. You know what? We don't know. So, you know, it can't. You know, as we think about protecting others and flattening the curve, and we'll continue to do that for a long time. You know, nothing hurts right now except not wearing a mask.
Absolutely. And two, it's great too. I'm going to say one more thing about this. They're amazing, beautiful masks, and they're $15. They're super affordable, and you're helping a small business that has transitioned their business and pivoted to try to help, you know, us be safe when we're out there and help us protect others. So maskforyou.shop is the link.
I will definitely order some. Thank you, Angela.
You're welcome. And then one more fun thing. Tracey, do you want to do our last little fun activity with our masks and end up the day with a cheers?
Yes, for sure. Well, I mean, this one is obviously very functional, but I think I'm going to put this fun one.
Does everyone have their mask?
Hands up.
Who has a mask?
Show your mask.
I can't get mine over my earbuds.
All right, here, I'm going to put it on my.
Aaron, where's your mask?
It's at the front door. I only use it when I go outside.
Aaron's like, I'm not going to get the mask. I don't want to touch it.
Hey, cheers.
Don't touch the mask.
That's going to follow the rules or saw the memo.
All right,
Oh,
cheers, everyone. Stay
cheers,
safe.
everyone. Thank you,
so
Tracey
much,
and
you
Myrita.
guys. Take care.